So it's my pleasure to moderate the panel. We have several excellent speakers that will talk about their work centered on both systems as well as structures, both in the US, but also globally. Our first speaker is Vivica Kraak. She is an associate professor at Virginia Tech in the Department of Human Nutrition and Exercise. And then also Deborah Salvo, who is at the University of Texas at Austin in the Department of Kinesiology and Health Education. And then lastly, Lindsey Taillie, who is an associate professor of nutrition at the University of North Carolina, Gillings School of Global and Public Health. I'm going to kick it off, so we'll have some time to really have a vibrant discussion, and I'm going to turn it over to Dr. Kraak. And also, it's my pleasure to engage her. I know that you're alumni of Cornell DNS. Your BS was from Cornell, so I'm always excited to see another Cornellian, and I'm going to turn it over to you. Thank you so much.
Thank you, Angela. I'm really excited to be here today to share some insights about maximizing the influence of choice architecture and marketing mix strategies for healthy diets and physical activity in diverse settings. Next slide. So I received funding from a USDA NIFA Hatch project that helps me with my research on sustainable healthy diets and food systems, and otherwise have no competing interest to declare. Next slide. So the concept of nudge and nudging really emerged with a seminal book that Richard Thaler and Cass Sunstein, both are economists, that was released in 2008, that defined nudging as any aspect of choice architecture that alters people's behavior without restricting any option or significantly changing their economic incentives. So nudge attempts to influence people's judgment, choices, or behaviors in a predictable way by using their cognitive boundaries, biases, routines, and habits. And nudging is the systematic and evidence-based application and implementation of nudges to create behavior change. Next slide. So from a behavioral scientist view, and this is just a brief overview, nudge theory is rooted in behavioral economics, as well as consumer psychology and the philosophy of preserving the freedom of choice of individuals, which is also called libertarian paternalism, without the need for government interventions, legislation, regulation, or litigation. And it's important to point out that choices is very different from agency. Choice is relational. You can have 20 different choices of different products or brands to buy, but agency is actually the capacity of individuals or groups to act independently to decide what and where to eat, or how and where to be physically active. And it's based and grounded in their values, beliefs, interests, and identity. Nudges may be used to alter either the properties or the placement of different objects or stimuli in microenvironments and settings, and they cue health-related behaviors. But what's important to also keep in mind is that they exclude pricing, which is not technically, according to Thaler and Sunstein's definition, a nudge strategy. It's a marketing mix strategy. So it's just important to keep that in mind when we think about combining different strategies to encourage behaviors at scale in different settings. And finally, nudge effectiveness is based on 3 assumptions: that people will choose options that require the least amount of mental or physical effort, people will align their behaviors with prevailing social norms, and they'll identify with peer or cultural groups that reinforce specific behaviors. Next slide. So I'd like just to share briefly the conceptual underpinnings of nudge. On the left, you see a framework that differentiates choice, which is relational, versus agency, directional. And on the right side, what we see is that behavior change across individual versus context. There are many different theoretically grounded frameworks that can be used to plan and execute in order to influence behaviors. And behavioral economics and choice architecture in the upper right-hand corner really rely on individual characteristics or psychographics of people as well as the context. Next slide. So this is a busy slide, but bear with me here. So on the far left side, I want to just point out the evolution of our thinking around the use of nudge strategies. And a lot of this research has come out of the United Kingdom. In 2010, the Behavioral Insights team, which was initiated by the government, had developed the mind space framework, which shows all the different factors involved in how choice architecture might influence populations. And then Professor Teresa Marteau and her colleagues at the University of Cambridge had further evolved the research to develop the TIPME framework for changing the selection, purchase, and consumption of food, alcohol, tobacco products in various micro settings. But what's important with that research is that they've really begun to think about going beyond choice architecture and advancing behavior change at scale. And that really involves combining absolute and relative availability of healthy or sustainable choices in different microenvironments. And on the right side, also from the UK, we see that the Behavioral Insights team is now thinking about using nudges for low, moderate, and high impact behaviors to promote sustainability. And what they do is they look at the willingness, perceived ease, and normality of green nudges that are more sustainable nudges. And if you can just look at the high impact area, you see, for example, blue is perceived as easy, pink is perceived as normal, yellow is high willingness. For flying less often, airplanes or internationally, you see that it's perceived as easy and there's a willingness to do it, but it's not socially normalized. And if we look at the next option, eating less meat or dairy products, which is what is being encouraged now for a lot of sustainable, healthy dietary choices, are neither perceived as being easy or normalized, and there's a low willingness. So we just need to keep those factors in mind when we think about using nudge strategies in different settings. Next slide. So very briefly, the Nuffield Policy Intervention Ladder was another UK innovation that looks at governments down below can design different types of strategies to change behavior by either doing nothing or simply monitoring the situation, all the way to providing information, enabling choice, guiding choice through changing default choices, guiding choice through incentives, disincentives, all the way up to restricting or eliminating choice. Click, please. And so what we know from some of the research in the UK is that there's a mismatch between perceptions around the effectiveness of the obesity interventions and people's perception of what is effective. So when we look at what the research shows is most effective in changing people's behaviors in certain settings, eliminating choice or disincentivating choices through advertising restrictions or through taxes, are not perceived to be as effective. And then click, please. We also see that people are less willing, their acceptance of more restrictive nudges. So this is something that we really still have to work on, because in 82% of this large sample that was studied, people still believe that maintaining a healthy weight is a person's own individual responsibility and not environmental change that are needed. Next slide. So different types of nudges, very quickly. I think of these as blue nudges to encourage diet, physical activity, and health behaviors. We know more from the research base around healthy eating, around nudges, particularly to promote fruits and vegetables, drinking water, compared to physical activity, but that have been used to encourage people to walk more in certain settings at airports or in government settings. But we also need to look at green nudges, which are being used to encourage environmental sustainability, behaviors across settings and sectors, algorithmic or digital nudges, which have been around, but they accelerated, especially during and after COVID, when a lot of people moved online, and it's AI-driven technology that influences what we buy online, such as groceries, meals, or products. And then finally, dark nudges, where these are marketing nudges, and they may provide misleading information that encourage unhealthy foods, sugary beverages, alcohol, tobacco, and gambling. Next slide. So just very briefly, I really like the way that some people have thought about organizing and describing nudges as thinking, feeling, or doing nudges, particularly to promote fruits and vegetables. And I think the Produce for Better Health Foundation has done this best with their Have a Plant campaign and movement, where they think about what people know, their facts and skills, what people feel, desires and emotions, and what they do, the routines, plans, and impulses. And we know that there's a higher impact when we focus on what people do. Next slide. So we really need to be thinking about how can we combine nudges, marketing mix, strategies such as pricing in settings at scale. And this is a real challenge that we've looked at a bit in the United States. Next slide. So I'll just share before we get to that slide, this is a great infographic from Change Lab Solutions, and it shows the need to really use strategies and interventions within and across sectors if you're really going to have a measurable, meaningful impact. In this case, it's unhealthy food and beverage marketing to children. We need to make changes across retail environments, childcare and schools, government property, and community-wide. Next slide. So this is some of our research that we've done at Virginia Tech in the past 7 years. We developed a voluntary marketing mix and nudge strategy framework to promote healthy restaurants across the restaurant sector. You can look at some of the strategies across place, profile, portion, pricing, healthy promotion, picks, timing and prompting, and proximity. And so what this does is to map different types of strategies that could be used. What we found from evaluations over a 10-year period is that very few changes or nudges have been used at scale to really impact people's choices. We know that chain restaurants in the US have reduced portion sizes for children, but have made much less progress in some of the other nudges. We also know that more recently, some of the voluntary industry pledges, such as the Kids Live Well initiative, which is the National Restaurant Association, has been around 15 years. And in order to participate, restaurants have to offer at least 2 children's meals, not 50%, not 100%, but only 2. And so I believe that we can be setting a more ambitious targets for the business sector to be aiming for, because they have great nutrition standards, but just not the absolute availability across settings. We've also made progress through policy changes in some states and cities where kids menus, particularly in California and other states, are making water and milk the healthy default. But that doesn't really happen for adolescents and for adults. So there's more that we can be doing. More recently, we're seeing nudges being used and embraced by the restaurant and food service sector for sustainable dining practices. And I'm going to actually move to the next slide because I'm running out of time. Next slide, please. I just want to show some of our work, and we can talk about this during the panel discussion on portion distortion, which is a major challenge. I'm hoping that the next Dietary Guidelines Advisory Committee will address this. And so what we need to be doing is thinking very comprehensively about how we can apply individual plus policy systems and environmental change strategies to establish healthy portion size norms to help Americans achieve a healthy weight. Next slide. So I'm going to wrap up with we need to be mindful of the competing persuasive marketing messages that people are surrounded with. We can design media campaigns, but we need to be mindful of some of the competing messages that may use emotional, positive messages and if we in government and public health develop rational or negative messages, that competes with the positive advertising marketing messages. And finally, next slide. And let's go to the next slide. So I'm just going to wrap up with my conclusions. Choice architecture nudges are most effective when behaviors require small subconscious changes. They're frequent and habitual for targeted populations. The behaviors are perceived to be positive, not negative or neutral, where pricing strategies such as marketing mix and policies, taxes and subsidies are used to help accelerate industry-wide adoption of nudges. And behaviors are socially normalized and incentivized and reinforced at scale across settings and sectors. And future research really needs to combine policy systems, environmental change strategies, and evaluate for feasibility, acceptability, and effectiveness for targeted populations in real life settings that are scaled up and sustained as a social norm. So I look forward to discussing this more in the panel.
Great. Thank you so much for that very interesting talk. Now we're going to move to Dr. Deborah Salvo, who's going to talk about environmental drivers of physical activity and really bring that global perspective. So, Deb, I'm going to turn it over to you.
Sorry, I thought I was unmuted before.
Right, thanks.
My bad. Thank you very much for the introduction and for the invitation to present in this excellent panel today. I will start by saying I have no disclosures to make today, no conflicts. And my presentation, as indicated, is on the environmental drivers of physical activity from a global perspective. So I will talk a little bit about my journey as a global investigator in this field. Next slide, please. And click, please. So I will start off by saying that when I started my work as a researcher back in, I will call this 2008, probably when I started my PhD program. I'm from Mexico originally, and I was very interested in doing work around understanding what the environmental drivers are of population patterns of physical activity in low and middle income countries like my own. And one thing that I had the chance to be a part of in a very small way was in preparing these maps for a publication. And I apologize, there's some, I noticed earlier today, but too late to make the change, that there's a mistake on this slide. The reference here should be Pratt and colleagues, but this was published in The Lancet in 2012 in a special issue in Physical Activity. So the journal there and year are wrong. But what I'm trying to show here is I helped produce a map, a set of maps that very simply show two things. The one on the top shows the countries of the world sort of graded in their size, either expanded or shrunken down by population size. So 84% of the global population resides in low and middle income countries. Yet, click please. If you look at where physical activity intervention research takes place, and this is based on publications, not necessarily the country of publication, but where the studies that are being reported in these publications are taking place, where we study how to increase physical activity in different populations of the world, is heavily focused and biased towards high-income countries of the world where a minority of the population resides. So the US, Australia, Europe, Canada, and you see entire regions of the world like Africa virtually disappear, and some very populous countries like India, Brazil really sort of shrink down. So if we had equitable research and equitable evidence of what to do to make populations more active, we would be looking at a map that on the bottom part of the slide that looks exactly like the map on the top part of the slide. As a reminder, I think most of you will be familiar with this, but it is important to note that physical inactivity is considered a global pandemic. Why? Because it's a known risk factor for multiple adverse health conditions. It is, there are over 5 million deaths per year attributable to physical inactivity. And this is while controlling for things like obesity and other risk factors. And this is a comparable number to the attributable deaths due to smoking every year. So it's occurring at a rate that is disproportionate, that is very high. It crosses international borders, and it occurs in more than one global region. All of these things that I just mentioned are what define a pandemic, according to the Dictionary of Epidemiology. So it's considered a global pandemic, and because it is considered a global pandemic, and because of the size of the problem, the field of physical activity research has really agreed that while individually targeted approaches or interpersonal approaches to get people to become more efficacious in becoming and staying active are helpful, they're not going to be enough to tip the scale in the favor of public health and of active populations. We need environmental approaches. Next slide, please. So with this, going back to sort of my own journey, which I will use for the presentation today, in terms of providing this global perspective, I back in the day as a doctoral student, a few years later, I went back to sort of see what was being studied in terms of environmental features that promote or hinder physical activity, especially in cities where the majority of the global population resides. And we know that the entire world is urbanizing at a very rapid pace. And one thing that popped up consistently, actually much more than green spaces, which I know was part of the title of the panel here, is to go beyond green spaces, was this idea of walkability. As a construct, walkability is a measure of how conducive a place is for walking. So it doesn't have to mean specific variable, specific type of indicators within it. It just, as an idea, represents a place that is, if a place is walkable, it has certain features that make it more likely that people that are there will walk. In the US, after several exercises of trying different combinations of variables and with very rigorous methods, a very famous index came to sort of emerge to the top to capture this idea of walkability. I call it the recipe for walkability, right? One of the multiple recipes for walkability, which combines three main features, really. Even if you see four in this formula, two of them represent part of the same construct. One of them is intersection density, which has to do with the connectivity of roads. So well-connected roads, if you want to imagine the city of Manhattan, New York, in the Manhattan part, if you have a grid in terms of the road sign, where there's very frequently occurring intersections, that makes things very walkable because distances are easily navigatable by foot. So that's what intersection density captures, is connectivity. Residential density highly correlates to population density, so that really captures this idea of lots of people in a given space. And then the two last items in this formula, retail to floor area ratio and land use mix, really get at the availability of multiple types of destinations in an area. If you have an area, even if it has a perfect grid and it has a lot of people living in it, but there's not a lot of places to go to, there's just homes, you may not get a lot of people walking around. So the combination of these factors led to this development of the walkability index. And it has been tested over and over again in American cities, and then more recently in additional high-income country cities for the most part. And it's very strongly associated with number of minutes of walking per day or physical activity per day. And this is irrespective of socioeconomic status. So for settings like the US, this index really helps predict and understand if an area is conducive to walking or not. But as I was going through this journey of understanding, you know, how do we know what types of environments we need to be supporting in low and middle income countries to promote physical activity and walking, which is the most common and easily accessible physical activity for most people in the world, it came to my mind that probably what works in high-income country settings may or may not be relevant for low and middle-income country settings. Next slide, please. So back then I was living in Atlanta, which was one of the initial cities used to validate this index. And the outskirts of Atlanta, as seen from an airplane, this is a picture that I took, looked like this. Not really good connectivity, lots of cul-de-sacs, etc. Not really good destination accessibility. And as you may expect, population density is not very high here. And then click, please. This is another picture I took from an airplane of my hometown, Mexico City, as I was landing. And this is how the outskirts of Mexico City look like. Really good road network connectivity. It may not be evident by the photo, I'm not sure, but there's lots of destination accessibility. Most of these street blocks have a store or something in one of the corners or more than one. So very good mix of residential land uses with other things and very high population density. So my hypothesis became, back then, I was sort of like, well, I bet that this walkability index will not be predictive of variations, spatial variations in physical activity in a city like the one I grew up in. Next slide, please. So this led me to my dissertation work back in the day, where in a Mexican city, a smaller city where we had institutional partners, we conducted a study. And I won't bore you with the details of the methods, but if you're interested, I can share more of that. But what we found was sort of interesting. I was hypothesizing a null association, and what we saw was actually an inverse association between the walkability index and physical activity as measured objectively with accelerometers in a representative sample spatially distributed in the city that had representation from different socioeconomic strata. So this was really interesting to me, that the US walkability index was actually the anti-walkability index for Mexico, or so it seemed. Next, click, please. Thank you. So then I did some more studies with colleagues looking at our data from this study, but sort of decomposing the index and looking at its components. On the left hand of the slide, what you can see is an initial analysis where we did GIS-based, meaning objective assessments of these neighborhood characteristics, and tested the association between each of the main components of the index with our objectively measured outcome of physical activity. And on the right-hand side, you can see we also collected survey data, the perceptions of the environment by people and how the different constructs were associated with physical activity. And a short story is what we really found as being the main driver of this was street connectivity, which first was very puzzling to us. And we also saw with the objective measures of the built environment an inverse yet weak, significant but weak, meaning the slope wasn't very pronounced, association between residential density, which again correlates strongly with population density and physical activity. Next slide, please. So fast forward many years more. So this is a very recent publication that myself and colleagues had as part of a special issue for Lancet Global Health in 2022, where we pooled data from, thanks, I'm looking at the time, yes. We pulled data from multiple studies, just like the one that I did in the Mexican city, and those of many other countries. So we had data from 17 cities of the world using the same methodology that I had used to look at these associations between population density and physical activity due to walking. And what you can see here in the two graphs, the one on the left-hand side shows population density, the one on the right-hand side shows intersection density, so road network connectivity, is that the relationships are actually curvilinear. There seems to be a very strong and pronounced direct association with these neighborhood features and physical activity levels up until a certain point. But then the relationship flips. Next slide, please. So this has led me and others that work in low and middle income countries to really start thinking about how can we go beyond walkability, certainly green spaces too, to identify what the real driving forces are behind physical activity patterns in low and middle income countries of the world where the majority of the population lives. Click, please. So rather than focusing on these three features, looking at click, please. Looking at some additional features that make up public life. Next slide, please. And I promise I'm almost done. I know I'm a little over time. So this has led us to conduct mixed method studies, where really we're trying to understand what is it about high population density and in particular high intersection density that makes areas less walkable. If you think of an area that has a lot of intersections, a good grid pattern, or even more than that, it should be walkable. But the story is not just told by urban design or by the availability of public of green spaces. More than things being green or not green, really what we're seeing is we are identifying a common enemy, so to speak, which are cars and car-centric design. So this has led us to really start understanding the importance of car-free spaces for physical activity as a critical driver of population physical activity. Next slide, please. And it has also made us question if active living is always can always be seen as a healthy choice, because for many across the world, it really is the only choice, and it occurs in very suboptimal conditions. Next slide, please. I will skip the next two slides and just go to sort of like the last slide, please, because I'm out of time. So this one, yes. So I just want to close by saying that it's important when we work in global settings and even in local settings. If we're working in low-income communities or communities without the same type of quality environmental resources for physical activity, especially for utilitarian physical activity, for active travel, to start understanding things from a contextually relevant and contextually respectful approach. So yes, it's okay to start off in a field by adapting and replicating things that others have done in the past. That's exactly what I did. I tested an index that had been used and seems to work for many cities of the world, and describe the differences found. But we can't just leave things at that. Really good contextually relevant and contextually responsive research should then look at these differences and rethink our approaches, and then go into this realm of actually asking better questions, developing better measures that make sense for the context and for the population that we're studying. And I think with this, next slide, please, I'll end my presentation. Thank you.
Thank you so much, Deb, for that presentation, and really that focus on contextually relevant spaces and research. We will talk about that more during the discussion, and I know we're short on time. I'm going to turn it over to Lindsey to talk about lessons learned on international food policy. So thank you so much.
Hi, everyone. I'm so excited to be with you and to have just heard these two great presentations. I'm excited to build on Deborah's talk and share some experiences from global food policy. I don't have any conflicts of interest to disclose. Next slide, please. So I think it's always important to provide a little bit of context. Similar to the US, poor nutrition is a top risk factor for obesity and non-communicable diseases across the globe. Along with obesity, diabetes, and other chronic diseases, many countries across the world have seen rapid increases in sugary drinks, as well as ultra-processed foods high in calorie density, added sugar, saturated fat, and sodium. So dietary patterns that are really dominated by these foods, similar to what we see here in the US. Next slide, please. And the framework that we take in this work is really one that kind of stems from the commercial determinants of health, right? So this is a problem that the food industry has created, and it's created this kind of systemic food environment, which makes it really difficult for people to make healthy food choices. So this includes the fact that unhealthy foods tend to be cheaper than healthy foods. As Vivica mentioned, we live in a landscape that's dominated by child-directed food marketing, which is really creating preferences for unhealthy foods very early on in life. And what's interesting is that we've looked at this in many countries and seen the same pattern globally speaking. In addition, we have a landscape of very confusing food labels, right? So in the US and in many other countries, we see a high prevalence of nutrition and health claims that make it really difficult for consumers to figure out what's healthy. We know that people only have a few seconds to make these decisions, and even when they want to make healthy choices, it's very difficult because they just don't know what's healthy versus unhealthy. And then lastly, we have an issue around what kinds of foods are our institutions providing. So here, a good example would be school meals, where kids are getting a third of their daily calories in school settings. We have universal school meal programs in some states in the US and in other countries. And so it's really important to think about what kinds of foods are kids getting, not only because it affects their dietary intake, but also, again, creating food preferences that can last a lifetime. Next slide, please. So my work is really working in countries across the globe on these four key policy areas. And I'm going to provide a couple of examples today on how some of these policies can help address this food environment problem. Next slide, please. Okay, so I'm going to talk about a case study. Next slide. Which is the Chilean law of food labeling and advertising. Next slide, please. So as I mentioned at the beginning, Chile is a country in Latin America that has a very similar pattern of chronic disease and dietary patterns, as does the US. So a high prevalence of overweight and obesity, as well as one of the world's highest consumptions of sugary drinks, along with ultra-processed foods. Next slide, please. So in 2014, to address this, Chile implemented a set of policies. So they already had a sugary drinks tax that was increased slightly. And then in addition to this, they applied a set of 3 policies to foods that are high in sugar, saturated fat, sodium, and calories. So the first one of these policies is probably the one that's gotten the most attention. And this is front of package warning labels. So these are the black stop signs that you see on the screen here. And these go on any food that contain high levels of these nutrients. And so it's really easy to see very quickly, because of these stop signs, which are these foods that are kind of considered unhealthy. But the Chilean law went even farther and said, okay, well, they're really focused on childhood obesity specifically. So how can we change this food environment? We're going to really strictly restrict the directed marketing to children of these unhealthy foods. So any food that has a warning label can no longer use characters like Tony the Tiger. They can no longer be shown on children's television. And then in 2018, this law went even further and they said, you can't show advertisements for these products between 6 a.m. and 10 p.m. And that was something that's really important because as research has found, kids are watching a lot of TV that's not necessarily just children's programming. So we think about the Super Bowl, we think about the World Cup, we think about the upcoming Olympics. Those aren't children's programs. And so the Chilean law attempted to address this by saying, all right, we're not going to allow unhealthy food advertising on TV during the daytime at all. And then the last piece of this policy was really about the school food environment. So products that carry this warning label can't be promoted or sold inside of schools. All right, next slide, please. So this policy was really, was, and I would say still is considered one of the most comprehensive food environment policies in the world. So what happened? Next slide, please. So this is what this looks like. Here you can see these are products that all carry, 1 to 3 warning labels. In Chile, it's possible for a product to have 4 warning labels. And actually this cookie that you see here that's similar to an Oreo, sometimes you'll see it with that many. And I think the thing that's really noticeable here is just how clear it is. This black and white label, it really stands out from the package. And when a product is high in multiple nutrients of concern, you can really see that quite clearly. The other thing that was notable in Chile is that compliance with this law was really high. So our collaborators there found that nearly, 95% of products were in compliance with this law. So when you go to a Chilean supermarket, and I have lived there for some time myself, and you're walking down an aisle, it's really a radically different environment than what we have here in the US because all you have to do is look at these labels and you can kind of tell, okay, this has a lot of sugar. All right, next slide, please. So along with this, we were really interested in understanding what happened with the child-directed marketing. So what happened to the characters and all of these other techniques. And we looked at breakfast cereals as a particular product category of interest because it's one that we find can be very confusing for people. There tend to be a lot of nutrition claims. They can often be promoted as food that is healthy. And so what we saw is that between, when this law was first introduced, the prevalence of this type of child-directed marketing on unhealthy cereals decreased from 43% to 15%. Next slide, please. And the changes in television advertising were even more profound. This is actually from our initial evaluation of the very first law, which was just looking at child-directed programs. When we incorporated the universal daytime television ban, we saw even bigger effects. But basically, kids' exposure to unhealthy TV food ads dropped by around 50% with that first law, and then it was more like 75% with that second law. So this is a really fundamental food marketing environment for kids. Now, it's interesting because it's not to say that there was no food marketing at all. So on the left, you see an ad, like a snapshot of an ad for Coca-Cola that's involving kids. After the law, that was no longer allowed. So what you see instead is you see adults and they're actually marketing Chile's equivalent of Coke Zero. So we'll talk a little bit about some of the ways that the food environment has shifted in response to these laws in ways that are not totally expected. Next slide, please. So one important aspect, particularly with regards to a labeling law, we also see this with taxation policies, is that they can really incentivize food manufacturers to reformulate their products in order to avoid the regulation. We actually saw this here in the US with the introduction of mandatory trans fat labeling. Even though companies were still allowed to use trans fat, they didn't want to have to put that on their label because they didn't want consumers to see it and think their product was unhealthy. So the introduction of that trans fat labeling led to reductions of trans fat in the food supply. And that's what we saw here in Chile as well. There were meaningful reductions in sugar and sodium in particular in response to the law. They really occurred right around the regulation cutoff values. So what that tells us is that's a super important aspect of this. Companies are only going to shift insofar as they have to be able to avoid that warning label. And then of course, products that are really far from that threshold, things like candies or maybe like ice creams, those are not going to reformulate because they're simply too far away from that threshold. And we also saw really big reformulation in beverages, which makes a lot of sense because it can be relatively easy to shift from using sugar in a drink to non-sugar sweeteners. Next slide, please. This was some of the work that we did trying to understand, well, okay, how is this actually going to affect people's behavior? And what we saw is that purchases of products with these labels decreased. And so these are really sizable effects in terms of reductions in calories, sugar, and sodium. People were switching from products that carried the labels to products that no longer carried the labels. One thing that's really interesting, and we're still parsing out, is the extent to which this reduction in critical nutrients was due to actual consumers' choices versus the reformulation. So was it the products losing the labels or was it the consumers making changes? Next slide, please. So when it comes to labeling policies and all policies, and I really appreciate the discussion about equity and equitable approaches that has been happening here today, we really are conscientious of this when it comes to policy too. So who is this policy working for? How are people understanding this? And what we saw, this was two cohort studies of adolescents and preschool moms with low education and low income in a particular neighborhood of Santiago. And what we found, first of all, was there was really high support for these policies. So speaking to some of Vivica's earlier comments, the administration in Chile that implemented this law changed, and the subsequent administration was very interested in rolling back this policy, but it had such high support because people really liked it, which is what you're seeing here. But we also saw that people really understood the labels. They knew that that warning label meant that a food wasn't healthy, and also that more labels meant that a food was less healthy than if it only had one. Next slide, please. And really, these labels were most helpful for product categories that were confusing. So like this quote on the left, these late logos, they help you a lot. Sometimes there are things you wouldn't even imagine had that much sugar. One thing is knowing that it's sweet, and another is knowing how much sugar it has. So again, things like yogurts, breakfast cereals, where there's a lot of confusion. And then the quote on the right really speaks to the importance about the comprehensiveness of this law. So the school policy interacting with the warning label policy. Because of this new law, my daughter has been taught a lot about these logos. No, mom, you can't buy me that. My teacher won't accept it because it has those labels. All right, next slide, please. One common critique of the food industry and trying to advocate against these policies is that it will be harmful to the economy. We've done this research in Chile and Peru and Mexico, and really so far what we're seeing is that there has been no adverse impact on the economy. And if anything, there's some evidence of leading to new product innovation and stimulating the development of healthier products. Next slide, please. So what happened over time? This policy was first implemented in 2016. And one thing that we went back out in 2021 to do focus groups, again, amongst moms with low incomes. And what they told us was that price was really important. They said, I see the price, not the labels. Food with labels are clearly cheaper and less healthy, and healthy food is more expensive. And so basically what they told us is, hey, listen, we're using the labels, we know what they mean, but we can't afford to buy the healthier food. So now we get into a question of ethics. Now you're telling people it's unhealthy, but is that really fair if they still can't afford to buy what's healthier? Next slide, please. Next slide, please. So to address this is something that the Chilean government is taking really seriously. We're working with folks at the University of Chile to work on Bolsillo Saludable, which is a healthy food incentive program, which is really all about using the Chilean dietary guidelines, which are based on seasonal local produce, to give low-income families money to specifically buy minimally processed foods, fresh fruits and vegetables, at their local farmers market to address this issue, this kind of structural issue, and making sure that healthy foods are accessible and affordable. Next slide, please. Okay, and kind of speaking again to something Vivica mentioned, which is around, pricing structure. So when we want to make sure that foods are affordable, we also want to address the fact that unhealthy foods are in some ways have a lot of cost externalities that are not currently being borne out in the market, right? So we know that the consumption of these products is leading to high healthcare costs, and that's not currently being reflected in the price. So Colombia actually is a country where we're working on a current evaluation of this really significant taxation policy that just started at the end of last year, where they're taxing both sugary drinks and ultra-processed foods up to 20% by 2025. So that's going to be something that's really interesting to see moving forward, how that also affects the food environment. Next slide, please. So in conclusion, I think the Chilean experience is a really good case study to show how this comprehensive package of policies can shift the food environment. But really, we need to even be more comprehensive and making sure that to address equity, we need comprehensive packages of policy action that also ensure healthy, affordable foods for everyone. Next slide, please. Okay, these are my acknowledgements. Thank you so much.
Thanks so much, Lindsey. So now we're going to go into our Q&A portion. And I want to start out with a few questions because, and you can turn your cameras on. I wanted to start out just with a few general questions for all of the speakers, just to make sure we have your thoughts. I think that there's several themes that kind of cross the presentations when it comes to not only the idea that we have these environments, but really local context matters because people are interacting with these environments. It's not just that we have this sort of static, like these policies exist. People are making decisions within this kind of these opportunities. And that may vary depending on what resources people have. I think Deb highlighted very well with the idea that a lot of people are engaging in physical activity out of necessity, out of transport, not sort of this leisure time framing. So when you think within your different fields, what do you think is some important things that we need to think of next when it comes to research on this person environment or person policy context interaction? And I'm going to start with Vivica.
Well, I think with a lot of the attention recently on sustainable diets and climate change, there's an opportunity to shape and to test messages around health or healthy weight that are linked to diets that are environmentally sustainable. So we need to develop messages that are compelling, that resonate with people to get them physically active, both for their own health, but the health of the planet and ecosystems, out walking, which are better. So in the global syndemic report that Lancet released in 2019, we talk about those as triple duty actions to address undernutrition, overnutrition or obesity, as well as climate change. So we need to not only think about packaging policy interventions or strategies, but I also believe it's important to have policy coherence, that if there are policies, they should reinforce each other. And we're looking at some really interesting work now on countries that have passed national sugary beverage taxes, but not all countries have developed clear, actionable messages in their national food-based dietary guidelines that encourage healthy hydration. So how can we do the packaging as well as the policy coherence and then make it contextually relevant for people?
Thanks. Any thoughts from your perspective, Deb?
Yeah, thank you very much. Well, this question, I love it because it's really what I've been thinking of for many years about how context matters. And a one size fits all solution would be really nice, but unfortunately, for health behaviors that for us are health behaviors, but for everybody else occur because of reasons that have very little to do with health. Like physical activity can be your way of transportation, even when it's during your leisure, it can be for fun, it can be for social interaction, it can be for your own sort of like personal aesthetics about your body, but not necessarily like a health outcome. And you can probably think about these things for food too, of all the meanings that food have and the reasons why people choose what they eat. I think it's very important to consider context as a sort of critical entry element. And what I would add, I really agree with everything that Vivica just said. The presentation by Lindsey really resonated with me too. Is that it's not just about thinking of context as this added sort of variable that we adjust for or take into consideration as an afterthought, but really for us as researchers, and when we do promotion of health behaviors, it really should happen at the very beginning of our process to think about context and see, is what I'm, not even the measure I'm using, is the research question I'm asking, does it make sense for this context at all? For instance, a context like Mexico that I've studied a lot, where most physical activity is necessity driven. So if you look at overall prevalences of physical activity, it looks like the population is fairly active, but a lot of it occurs in really bad circumstances, really unsupportive environments. It's not Amsterdam where people are walking and cycling, etc., that have other health risks and risks for human dignity, for ethics that was brought up earlier too with the food side. I think we need to make sure that what we're trying to do makes sense. So for Mexico, I think maybe it's not increasing total activity, it's increasing opportunities for leisure activity and maintaining the necessity-driven activity in optimal and dignified conditions. So I think we need to even change what the goal is sometimes. Yeah.
Thanks, Deb. From your perspective, Lindsey?
Yeah, I mean, for me, I'm looking at this question in the chat about anything to reduce exposure to YouTube ads and other stream media. And I actually think that plays into this broader question about context, because as someone who studies the effects of the food industry, they're really good at this. They're really good at perpetuating messages that are highly targeted to the consumer. And I feel that we in the public health sphere are like decades behind. We're coming out with messages or strategies that may be a little tailored, maybe, whereas the folks that are promulgating the high consumption of these foods, they're doing it in a way that's being delivered directly to people's phones all day, every day, from the time that kids are starting to watch YouTube at age 5. And we just can't, I feel like we're still kind of stuck in decades past. So if we could find a way to really come up with interventions and policies that are accounting for this like nuance of where people live and what people prefer and what else they have going on in their lives, I feel like we would be able to make more progress.
Thanks for that, because that actually leads me into my next question, which of course I wouldn't be me if I didn't ask about equity. And I know that was mentioned across the board, and I'll put it out to an entire panel. The last discussion about YouTube and targeting, when you think about equity, how do you bring equity into the perspective of your work, whether it be measurement, the questions, as Deb mentioned? If the question doesn't fit, we have to think about the research question at its inception. So how do you think about equity in the context of your work? And we can start with you, Lindsey, since you ended from that perspective in response to the question about exposure.
Sure. Yeah. I mean, so one thing that I've been working on a lot, as have many others, is understanding what an effective front of package label design would look like here in the US. The FDA is currently researching options and set to release a proposal hopefully sometime this summer. And like I mentioned, one question is, are these labels going to be accessible to everybody? Back in the White House, national strategy, they explicitly said we want front of package labels that make this nutrition information that's really complex more accessible. And so that's a really important question. And so one of the things that we've been doing, because we know that these labels are likely to be in English, is we've been trying to understand what the likely effects would be in populations that have lower English literacy. And so we can kind of see now, are folks able to understand these? And if they're not, what are some other strategies that we could use to increase that communication tool, even for folks who may not necessarily understand the words? So could we use shapes or colors or icons? So that's something that's always really important when we're thinking about policy design, is how is this going to be, accessed by the entire population?
Thank you, Deb. And then we're going to come back to you, Lindsey. We have a question in the chat from the audience to make sure that we get our questions that are coming from the viewers. But I'm going to turn it over to Deb. How, in short, have you been thinking about equity in the context of your work?
Yeah, I think I'll try to be brief. My entire work is driven by the pursuit of health equity. To me, and maybe this is my Latin American training, I was born and raised and partially trained in Mexico. Public health goes hand in hand with equity and social justice. So to me, the goal in public health should be to reduce health disparities and health inequities. We know, I think for a lot of what we're talking about, we really do know what works, and we have really good case studies from across the world of what the ideal circumstance could be, ideal environments, ideal policies, etc. But the truth is, not everybody has access to these things. So really trying to reduce that gap has been at the focus of my research. And even as I started with the map of the world, where we do research and where we do promotion and how we do it and how our messaging is for some people and not others, to me is at the heart of good public health. And that can be implemented locally and globally.
Thank you. Vivica?
Just real briefly, my current research, because I like to think about where am I going to invest my time in the future to ask meaningful questions. So I've been thinking a lot about food systems governance. Who are the actors? What are the power differences between them? And also, what's our vision? Do we want to stay within a neoliberal political ideology? Because that's where nudges were created to pretty much perpetuate our current food system the way it is, which is inequitable, unhealthy, unsustainable, not resilient for climate change. So how can we establish the vision? What's the political ideology? Let's be explicit about it. And then what's the paradigm? Are we maintaining or slightly reforming our current unhealthy, unsustainable food system? And what is it going to take to adopt more progressive, radical approaches that are driven by democracy to transition and transform to healthier and more sustainable diets and food systems? So I think we really need to be explicit about understanding political ideology, paradigm, discourse, and governance. And then my big thing now is like, how can we use hybrid and digital activism? Because I'm connecting and learning from people in other countries around the world through digital platforms. So how can we harness that? And what can we learn from the climate activists that we could potentially use in the US and other countries to really forward progress toward healthy, sustainable food systems?
Thank you. We have a question from the audience for Lindsey. Oh, excuse me. Lindsey, could you discuss how the communities are informing the policy changes that avoid the addition of costs at the point of food purchase? This is especially important to low-income communities, food insecure communities. Can you talk a little bit about that?
Yeah, I'm not sure if this question is referring to taxes or to labels or what exactly, but I'll speak a little bit to my experience about the involvement of communities in policy design. And that has been a little different everywhere. But generally in other countries, this work is really being led by kind of grassroots coalitions, which are often comprised of folks from the health community, but also a lot of times it's comprised of parents. And the really effective coalitions have done a good job of going out and really bringing people to the table to understand proactively what the potential unintended consequences of these policies would be. So things like potential price changes, for example, even if that's not baked into the policy, so that they're able to then go and talk to the Ministry of Health or talk to the Ministry of Finance to try to preempt some of these. I will say that hasn't always worked. And that's why we have things like in Chile, where I don't think that was something that was really thought through. And so now after the fact, there's a lot of community conversation about how can we address this with additional policy moving forward. So some of it has been a little bit of trial and error, but I see that the countries are learning from each other. Deborah, working in Latin America as well, there's such an amazing network of folks that are really well established, and they're building on each other so that subsequent policies are getting more comprehensive and able to address these issues more proactively.
Thank you so much, and thank you for those great presentations and wonderful comments. I think we have about 30 seconds left. I'm not sure if anybody wants to just give one closing thought before I turn it over to Dan. Does anybody have a pressing thought to close out the panel? No pressing thoughts. So, and we're right at time. Thank you so much. I'm going to turn it over to Dan.